vitamins, certain minerals, and for those kind of people, it is recommended that they should be taking some kind of vitamins. And but again, there are certain vitamins, and the efficacy of those vitamins are there, especially antioxidants. They are very good for your blood, they are very good for your metabolism. But again, once in a while, if you like recently, previously it was a belief that vitamin E high dose is good for your body. Recently an article came in and it explained that the people who are on high amount of vitamin E, they live less longer
Is
than
that right?
people who take less amount of vitamin E. And sometimes
You know,
controversies
these
always comes.
studies, these studies actually lead me to a political question because I like to talk about politics. High cost of medicine in America. I mean, uh, why? Why medicine is so? I'm not just talking about the medicines, buying the medicine, but the treatment of sick people in America is very expensive. Are we talking about quality here? Or we're just talking about just it's capitalism here? Or what, I mean, well, the government needs to jump in and involve in this issue, but it is expensive.
Yeah, actually, what happens that uh, I would not blame pharmaceutical companies completely on this issue, because what happens that all these medicines which are coming to us, they are by the sincere effort of these pharmaceutical companies. They spend millions and millions of dollars to do these studies and spend so much money and come up with these wonder drugs. And then when they come up with this medicine, then surely everybody who is in business, they wants to make money, and then they come up with this pricing and all those kind of things. So one thing is that we should appreciate these pharmaceutical companies of coming up and doing research thing. The second thing is, especially in the United States, we can afford or we can pay the higher amount compared to other part of the world. That's why they ask us to pay. It's a very important issue. That's the same medicine which you can go across the border
Sure.
in Canada or in Mexico,
Mhm.
and you can get the medicine in pennies, which you pay dollars on those things. So that that should be some kind of limitations, that a person should not be affected if he's living in US and who cannot afford to pay for these high cost medicine. So surely there should be some kind of a regulation, who should be putting this kind of a cap thing, so that people should not be affected, and the medicine and the health and the people who are who need to be in good health or who are diseased, they can access to this medicine. So I think it is very important that these medicines price should be controlled and should not be out of proportion, because the same company who is selling one tablet here for $2 or $3, same company in other smaller or other countries who cannot afford to pay that much, they're selling these
So it's
in
the
pennies.
same American companies?
Yeah, same
They sell 'em
American, same
cheaper outside.
international companies.
Mhm.
If you go to, even Mexico, if you are paying $3 for one tablet
But
over
again,
here,
this is so sad because well, the reason I said this is politically, talking politically here because I feel personally that somebody's making a lot of money, and it's done purposely this way. I mean, why you're selling it to Mexicans or Canadians cheaper, or you sell it to your own people in America more expensive? A lot of people cannot afford medication anymore.
yeah, I think
We have
that's
a
why,
lot of poor
yeah,
people in this
yeah,
country.
that's why what's happening that a lot of people, more than 15% people who don't have any kind of insurance,
Sure.
and they are not only the people who are affected. The health cost is going up.
Sure.
People has to pay more and more in their medical bills, and a good proportion of their medical bills are taking away their income. And this is not only for a middle class issue, it is even this impact can be felt in upper classes
Sure,
too,
I agree.
because the money they are paying is significant.
Right. What about the FDA and their regulations, mainly with the operational procedure itself and or medication? Because sometimes they approve Europe approve a medicine or surgical procedure. They approved it 3, 5 years ago. And here you talk about it in America, and nobody knows anything about it. They say, well, no, it has not been approved by the FDA. We'll say, golly, they do these kind of surgeries in the Middle East, in Lebanon, or sometimes in London and in Germany. They do these kind of procedures and operations, as well as they have medication. But here, the FDA, it takes about 3 to 5, maybe even 10 years to approve something. So those guys over there have done years of research, and it's applicable, it's working, they're selling it. Is this a political thing again, or we are afraid of lawsuits in America?
No, I think it's both. In a way that what happens that we have our regulatory agencies who has to make sure, and they have to go to procedure to make sure that the medicine which are coming or pushing by certain or whoever pharmaceutical companies in the country here, they should be safe for the people over here. And they have to have a system place for the screening. And for that purpose, we have these regulatory screenings placed. But surely we don't have, there must be, probably I'm not aware of, that this is true, that there are a lot of studies being done and conducted in Europe, and they are very much
I feel
compatible.
like we are always behind. We are all 10 years behind.
Yeah, it's most like we take more precautions about launching any medicine or introducing any medicine over here, because you see that certain medicines, even after taking all these good measures, precautions, even you have to recall them after certain years.
And that's, I think that's very natural. It's normal.
Yeah, so that's why it's a check and balance system which is in place here. I think we practice the most superior medicine in the United States.
But you know what? I think we still have more lawsuits in America than in Europe.
Yeah, it's because
after all these precautions.
It's like our lawyer brothers also have to
you see,
survive here.
Dr. Saleem is so nice, man. But I'll say it very frankly. People like to sue.
Yeah, I mean, it's a system, and every system has use and abuse, and surely it's very it sometimes puts you in very defensive situation, because sometimes if you can be aggressive and you can do a lot better for the patient, but sometimes you don't go and you are not that aggressive because you think, oh, if this aggressiveness goes on to a south, so what will happen? Or you always be afraid of having these lawsuits things. So you get some disadvantage even in your practice. So I think having capitations on these lawsuits is very important. Surely it's every medicine is practiced, every doctor practice in their best best knowledge, and they try to make people better. And this is not only that you get paid and you are giving some services, but if you being a doctor, you take it as a challenge. I feel bad when my patient come second time to see me for the same problem. I have this feeling of failure, that how come I did something, or how come probably I missed something and this person is not well. Although sometimes it's that if the patient's immunity level is low, or the complexity of the disease is more there and he's not getting better. So we take our patient challenge and we provide best care to them. But still, things are not 100% in our control, and things can go on wrong side too. But it should not be punitive out of proportion. And it's, so that's why I think it will be in the best interest of the patient if we are not having this much pressure of being sued or thinking of those things, in our regular practice. So I think that will be more beneficial for the patients.